I have multiple myeloma, but I also have severe rheumatoid disease with low vitamin D. Should I be taking vitamin D supplements or avoid them? This is a particularly important question because vitamin D is an issue in multiple myeloma. We know that although it's more complicated than that, one of the things we can see with vitamin D is it helps push calcium into the bones. And sometimes we know that myeloma can cause high calcium levels if the bones are being eroded. As we give people bone strengthener drugs, we typically actually supplement them with a little bit of calcium and a little bit of vitamin D. In this situation that you've described where you have a low vitamin D level, that should indeed be replaced under the supervision of your rheumatologist or whoever's taking care of your rheumatoid disease. But it should also be discussed with your oncologist or your myeloma provider because we want to make sure that we give you enough but not too much of that vitamin D. Typically, we don't give too much vitamin D very often, but we want to make sure that we don't get those supra-physiological doses that sometimes people want to take thinking it's going to make it a lot better. But we know that many of us have vitamin D deficiency, either genetically or because of other diseases, or either because of our exposure or lack of exposure to daylight, that we often need vitamin D supplementation.